Whew, it is so hot in here. I'm sweating so much. Can somebody please put the AC on? In today's episode of Dr. Nora, I take you through everything you need to know about hyperhidrosis or excessive sweating, what it is, what causes it, and how we treat it as medical practitioners. First up, let's talk about sweating. We all sweat, and we sweat to regulate our body temperature. For example, you might be on a run and you start sweating, and actually what happens is that sweat evaporates off your skin and it creates a cooling effect on the skin, so it helps to regulate our body temperature. However, in about 3% of the population, sweating normally, unfortunately, isn't the case, and these people actually produce a lot of sweat, more so than the activity they're doing, and they could even be sitting at rest and they're sweating a lot. This is a condition known as hyperhidrosis, and it can affect common areas such as the hands, the face, the underarms, the neck, or even the feet as well. We don't quite know what causes hyperhidrosis, but we do know that it is an overactivity of our sweat glands, and so we produce too much sweat on a day-to-day function. There may be some genetic element to it, but generally speaking, we still don't really understand why it happens to some people. Now, as a general practitioner and a cosmetic doctor, I often see patients coming in with hyperhidrosis, and generally speaking, these people are quite embarrassed to present themselves to the doctor because they feel like it's a really social taboo if they're sweating too much, and also these people generally don't want to go to social situations. They don't want to attend meetings at work because their clothes are drenched in sweat by the time they get to work, and they often feel really upset and sad about this. But it is really important to know that if this sounds like you, or if you think you might be suffering from this, then there is help out there. And very shortly, I'll take you through some of the treatments that we have to help to treat hyperhidrosis. The first treatment that many doctors will prescribe to you is a strong antiperspirant. Now, I had a friend actually in medical school who used to suffer from hyperhidrosis of her hands, and she used to use a very strong antiperspirant which contained aluminium chloride. Now, aluminium chloride acts as a very drying agent. So what she would do is at nighttime, and this is what usually you would do as well, but at nighttime she would dry her hands and then apply the aluminium chloride onto her hands before she'd go to bed. And then she'd wake up in the morning and it would help her. However, what's really important to know is if you are using aluminium chloride, say on your hands, you must ensure that they are super dry before you put the antiperspirant on, because if there is any moisture on the skin, it simply doesn't work very well. Now, usually this should give you relief for about a day or so, and then you'd reapply it the next day. However, from experiences from other patients, this isn't always the most efficacious treatment, and there are other treatments out there. For example, you may be offered some medication to take. Now, the way that the medication works is that it actually stops those sweat cells from being activated. These are oral medications, and in saying that, they are non-specific, which means that not only will they help you stop your sweating, but they may also dry up in other places as well. For example, patients may report they have dry mouth, they may have problems urinating as well. And so these are great, but they may have some side effects that are undesirable. In other situations, your doctor may refer you to have something called ionophoresis, which essentially is where you are placing your hands, say, that are affected, or the area that's affected, in some water, and a low voltage current runs through the water, and that helps also to block the activation of those sweat glands. In a more drastic and invasive procedure, you may be referred to have some surgery to remove those sweat glands or to deactivate them. Now, as you can imagine, this is fairly invasive. But there is one other treatment out there that if you tried all of these options, or you're not too sure about surgery, then you may want to consider something like anti-wrinkle treatments to, for example, your underarms. Now, you might be thinking to yourself, well, Dr. Nora, anti-wrinkle treatments are just for the forehead or just for the frown, but what are you talking about? Well, actually, we can use anti-wrinkle injections in the underarms, and some specialists may also use it in the hands and in the feet as well. How does it work, I hear you ask? Well, when we put anti-wrinkle treatment into the underarms, say, it actually stops those sweat glands from releasing chemicals, and it acts as a drying mechanism to the underarms, say, which is really life-changing for a lot of people. And I personally have seen lots of patients that have come through my door, and they are so grateful for anti-wrinkle injections to their underarms because it works so quickly, and the onset of its action is that once it's injected, it takes about 1 week for it to start working, and it actually lasts for up to 6 months in total. So these patients will come in, say, at the beginning of summer when their excess sweating is really heightened, and they'll have their treatment, and then they're good for 6 months, and they may return back later on as well. The way that we do it as cosmetic practitioners is that we will ask you to shave your underarms, remove any hair so that we can see the area nice and clearly. We'll also ask you to avoid any antiperspirants for the 24 hours preceding your treatment as well. Then, generally speaking, we'll clean the areas up with some alcohol rubs, and we'll draw some boxes on your underarm so that we can cover a good area of your underarm to make sure that we're injecting into all of those sweat glands. You'll notice that your doctor will put your injections in really superficially because this is where your sweat glands live. And if we go too deep, we'll just simply miss those sweat glands. So it might be a little bit uncomfortable to have your procedure. However, the procedure itself should be fairly quick, and as I said, it does take about 1 week for it to start working and lasting up to 6 months. However, one of the downsides is that this can be a fairly expensive procedure and it is not permanent. So you will need to keep coming back for every 6 months for your top-up if you choose to go in that direction. But remember, of course, that not all patients are able to have anti-wrinkle injections, and this really does depend on your own individual factors. So be sure to speak with your own medical doctor for your own individual advice. Well, there you have it. That is what hyperhidrosis is, what causes it, and what treatments we have available. If you yourself are suffering from hyperhidrosis, let me know in the comment section below what you've had or what treatments you've been offered and whether they've worked as well. I hope you guys have found this video useful. And of course, if you have any questions or comments, please don't hesitate to drop me a line in the comment section below. And I'll see you on the next one. Take care and stay healthy.